Hello, good morning. My name is Aidan McIvor. Very happy to be talking to you this morning with my colleague Richard Biggers.
Hello.
I have the opportunity to present to you some work we've recently undertaken in assessing a recently introduced syncope pathway at the Royal Infirmary of Edinburgh. Grateful to our colleagues Matt Reid, Istheti and Martina Wojtowicz, and thank them for their help and support throughout this project period. Syncope, as we'll know, is a very common presentation to the emergency department with a variety of underlying etiologies ranging from the benign to very serious, often associated with adverse events. It's been recognised that these etiologies can be unclear at initial assessment, and as such, syncope may lead to high admission rates and costs. Back in 2018, a syncope pathway was introduced at the Edinburgh Royal Infirmary, and our aim was to assess the impact of this pathway on diagnosis, admission rates, patient outcomes, and specialty input. In terms of methods, we performed an electronic patient record search using those presenting with fainting episodes or loss of consciousness for an 8-month period pre and 8-month post pathway introduction. Exclusion of non-syncopal diagnosis then allowed consecutive sampling where 199 and 102 patients respectively had notes scrutinised and analysed, and allowed us to assess for the outcome measures of admission burden, referral onward to specialties, and 1-year outcomes.
So in terms of our results, looking at the pre-pathway group on the left and the post-pathway group on the right, we did see that there was a greater proportion of patients who were admitted or referred to outpatient services following the pathway's introduction, 46% compared to 30%, with a chi-squared test generating a p-value of 0.006. In terms of specialty referral, again, we showed that a greater proportion of patients had specialty input, whether that was from cardiology, neurology, or other, generally being medicine for the elderly. And significantly, we did find retrospectively that specialty referral and admissions were deemed to be appropriate in most cases. In terms of 1-year follow-up, we found that a large proportion of patients had an alternative diagnosis in the post-pathway group. And this could show that the pathway, whilst it does lead to more admissions and specialty input, it does help in terms of aiding improved diagnosis. In terms of syncope-related death, we showed that in the post-pathway group, there were 2 syncope-related deaths, although these were not cardiac and these were situational in nature. Doing a Fisher exact test to look at excess deaths, we found that the p-value was non-significant. And so to conclude, this is a picture of Princes Street in Edinburgh in sunset, so we're very fortunate to live and work here. Our findings are from this analysis of the pathway is that whilst we increased burden on secondary services, outpatient and admissions, we did demonstrate improved diagnostic capability with the pathway and also appropriate specialty input. Thank you for listening.